Welcome to Daily Debrief, brought to you by People's Dispatch. I'm Pragya. Today we bring you news about Israel refusing to let go of detained prisoners confined in harsh circumstances, the healthcare emergency in Gaza, and in Brazil, the presidential election campaign has formally started. Israeli bombing of the Gaza Strip stopped after a precarious truce on August 7, but the humanitarian situation in the besieged region has not changed. The three-day aerial bombing cost 49 Palestinian lives, 17 of them of children, but fuel shortages mean healthcare facilities are also struggling to stay afloat. This is on top of limited medicine availability 15 years into the Israeli blockade of the region. Financial support for Palestinian healthcare has been squeezed, denying people basic and emergency aid. The People's Health Movement has recorded the loss of multiple donors and fundings due to continuous harassment, intimidation, and lawfare in the region. We spoke to Anna from the People's Health Movement for more on the situation. Hi Anna, welcome. Good to have you with us again. Anna, can you begin by trying to tell us what was the effect of the recent aerial bombing by Israel?
Well, of course, the immediate effect was that approximately 50 people died and about around 400 more were wounded in Israel's latest attack on Gaza. But then in addition to that, the delivery of healthcare was also affected. So as reported by one of the health and humanitarian associations operating in Gaza, Al-Avda, they were feeling increasing pressure during the attack because of a combination of the effects of the medicine shortage that Gaza is going through at the moment, the shortage of medical equipment, which has been going on for at least the same time, but also because of the electricity shortage that the attack caused. So essentially what happened was that when the attack was happening, Israel blocked fuel delivery into Gaza, and many of the health institutions in the Strip rely on fuel for generating power. And of course, they need power to provide healthcare. So essentially what that meant was that allowed us to hospitals and 7 health centers had to start using their fuel reserves, which they had been accumulating over time to use in situations like this. But even with having such reserves, they were only able to generate power for 4 hours a day. So for 4 hours in a row. And then those 4 hours were followed by a 12 hours slot of blackout. And of course, you can imagine what kind of pressure you're working in if you're providing medical and healthcare in such conditions. And still, in spite of the power shortage, the health workers in the hospitals and in the health centers were able to save 23 wounded who came to the hospitals during the raids. And of course, the power shortage issues were not something that's limited to this latest attack. This problem has affected everything from healthcare delivery to agriculture in Gaza for 15 years now. And this is also illustrated by some of the UN data, which is being updated daily, specifically by the UN Office or for the Coordination of Humanitarian Affairs, which tracks the amount of electricity that Gaza can use every day. And this office of the UN recorded that during August 6th and 7th, when the attacks were ongoing, there was a significant drop in power accessible for inhabitants of Gaza during this time, and it was only 5 hours a day on August 7th. So although there was a ceasefire declared, as we all know by now, new attacks are expected by people living in Gaza. And so Al-Avda and other health organizations are preparing for such circumstances. They're trying to rebuild the reserves of fuel that they need. And, of course, because of the blockade, because of the occupation, this is not an easy task to fulfill. So there is now an international campaign being launched and supported by organizations such as the Belgian organization Viva Salud, which works with several Palestinian organizations, which had worked with several Palestinian organizations already, as well as the People's Health Movement, and they're trying to fundraise for Al-Awda to build back their fuel reserves.
Right, Anna. Anna, can you also go into a little bit of the 15 years? It's a very long time to be under a blockade. What has been the effect, especially on healthcare, of this blockade?
Well, essentially, just a couple of months ago, we have seen a report, which also the People's Dispatch reported on, which called the health situation and the humanitarian situation in Gaza as a human-made humanitarian catastrophe. And so, of course, when we talk about the healthcare in Gaza, we cannot really forget the attacks that happened just last year, so in May 2021, when Israeli attacks destroyed the only COVID-19 testing center, which was there in Gaza, along with destroying the administrative building of the Ministry of Health. So the blockade of Gaza and the recurring attacks certainly do, deplete the health resources that the Strip has can count on for protecting the health of the people living there. And in addition to that, it's also difficult to avoid the conversation about the permit system that essentially regulates what kind of healthcare is accessible in Gaza. And at the moment, it's not, it's far from great. In addition to blocking access to essential medicines, to essential medical equipment, which cannot be delivered to the Gaza Strip because of the Israeli imposed blockade. There's also an issue of patients from Gaza not being allowed to leave the Strip for seeking healthcare elsewhere. So if we look at some of the data from the report, we see that approximately 30% of the import requests for medical devices in 2021 were granted. And similarly, more than 1/3 of medical travel permits were either rejected, ignored, or delayed. So that means that patients who had to travel elsewhere to access healthcare were not able to, and an even larger number of patients and the people who accompany them were bullied during the time that they traveled. So they were exposed to road checks, they were exposed to detainment or even arrests by Israeli occupying forces as they were trying to access healthcare. And finally, it's not, as we know, it's not all about the access to health infrastructure only. So the report has shown that the situation that the blockade that has been going on in Gaza for so long is causing serious psychological and emotional trauma for people living there, including children. And there are, of course, enormous social consequences of the blockade. So all of these things are impacting people's health, and they can only be stopped if the blockade stops.
Right, Anna. And in the meantime, people sending out appeals for more fuel just to keep the health centers running. Thanks a lot for joining us. An Israeli prison has declined requests to release Ahmed Mansara, imprisoned for 7 years since he was just 13 years old. Much of this year, Mansara has been held in solitary confinement. Yet an Israeli court in Beersheba refused to end Mansara's solitary confinement despite his mental and physical condition, according to reports citing his legal defense team. Mansara developed mental health issues during his months of brutal interrogation, torture, and solitary confinement in Israeli detention centers. Khalil Avavdeh, another detainee in Israel, has been on hunger strike for 165 days against so-called administrative detention. Let us talk to Abdul about the treatment of Palestinians imprisoned by Israel for resisting its occupation. Hi Abdul, good to have you here. Abdul, can you start by trying to tell us why is it that the human rights group called Mansara's solitary confinement cruel?
When he was arrested, he was just 13 years old. And the charges against him basically did not stand in the court, and he was not found guilty. Still, the Israeli court sentenced him for 12 years initially, which were later reduced to 9 years. During the trial, he was tortured in prison by the Israeli security officials, and in order to get some confession out of it, which kind of created a long-term impact on his mental health. And he is not keeping well as far as his mental health is concerned. Some doctors are also claiming that he's physically also not fit. He's just 21 years old now, and given his mental and physical conditions, apparently there were a team of psychologists and doctors who recommended his release from solitary confinement, at least, if not from the prison. And despite all these background, well known by the court, the court refused to entertain all these submissions basically continued the solitary confinement, which will continue till November 21st. By that time, he will be in solitary confinement for almost a year. Just imagine the condition: a prisoner who has gone through a history of mental and physical torture, who is suffering from mental conditions, is not allowed to interact with fellow Palestinians in the jail and put into the solitary confinement on the ground that keeping him in solitary confinement will protect him from harming himself. This particular ground on which the Israeli court refused to release him from the solitary confinement was, of course, will be described as cruel. If, in fact, Amnesty International went on and said that this is not only cruel, it is also a legitimization of torture, which has happened with him in last 7 years. Imagine a teenager, a 13-year-old kid, not found guilty, still sentenced for 12 years. It cannot happen anywhere else but in Israel, where this kind of apartheid system, discriminatory system, is established to basically discourage to the Palestinian resistance against Israeli occupation.
Right, Abdul. Abdul, can you also talk about the general conditions of the political detainees who are kept in Israeli prisons?
Apart from the Mansara's case, we have Khalid Awavda's case. Then there are numerous other cases where Palestinian political prisoners who are resisting Israeli occupation have gone on. Some of them, of course, are sentenced, but a large number of them are also political detainees, what Israel calls administrative detainees, right. Which has no other precedents anywhere in the world. It is this particular arrangement of the law is considered illegal as per the international law, where you cannot keep a detainee without charge and without even any trial for more than a certain amount of period. Here, as per the Israeli law, you can keep an administrative detainee for as long as you want. So there are many political prisoners who are detainees, in fact, who are in the Israeli prison for years now. Apart from these apparently obviously illegal laws, which are nothing but a kind of confirmation to the assertion made by various international human rights organizations, including the UN, that there is an apartheid system, a system of discrimination between the Palestinians and the Israeli citizens. Apart from this, you also have the general Palestinians who are not detained, but who are also sentenced for various reasons. Of course, political prisoners sentenced according to Israeli law. They are also not in a very good condition. The prisons in Israel are inhuman. Most of the prisoners are tortured. They have claimed to be tortured by the Israeli authorities. they have also claimed that they are not allowed to meet their relatives, they are not allowed basic health and other facilities which are fundamental right of all prisoners, and particularly in the case of political prisoners. So Israel has systematically denied all basic rights to Palestinians, and as a part of its apartheid system and as a part of its collective punishment against the Palestinians.
Right, Abdul, a systematic denial of rights. Thanks very much for joining us. The election campaign is now formally underway in Brazil, and polls place former President Luiz Inácio Lula da Silva well ahead of incumbent Jair Bolsonaro. The gap between progressive Lula and right-wing Bolsonaro has grown in recent polls. Brazil's election campaign is charged as people grapple with economic crises. Plagued by high inflation and numerous other woes, people have been staging protests demanding a free and fair election as the populist Bolsonaro casts doubts on the election process. Let us go over to Prashant from People's Dispatch for more detail. Right, Prashant. So, Bolsonaro and Lula, what are they campaigning on? What does that say about them?
Right. So, it's quite interesting because they're campaigning from two very different ends of the political spectrum. They're almost diametrically opposite candidates, so to speak. And that a lot of it shows from the fact that their initial campaign events, Bolsonaro went to a place where he was attacked, Lula going to a place where he has a lot of political history associated with it, Bolsonaro making all these statements about the return of communism and all that kind of, the usual scaremongering tactics that right-wing leaders across the world do, whereas Lula has been talking about a very different vision of society. Now, we do know that, Lula has brought together a very diverse coalition of forces ranging from the extreme left, the most progressive sections in the country, to even some in the center. For instance, his vice presidential candidate is quite a centrist, a progressive centrist maybe, whereas Bolsonaro has sort of tried to focus on bringing out the maximum of his right-wing conservative constituency that really brought him to power. So two different visions of Brazil that we see. We'll talk about it a bit more later. But important to note that Lula has been talking about. Lula has a very powerful record. He brought millions of people out of Brazil, out of poverty. He raised the stature of Brazil internationally as well as a key global player. He was able to sort of introduce a number of programs which made social welfare much more accessible to a large number of people. And versus that, you have Jair Bolsonaro, of course, during whose time Brazil has had the second highest number of COVID deaths in the world. We do know that there's been a large amount of environmental destruction. The fact that democratic institutions itself have faced quite a number of threats. And Bolsonaro himself is generally sort of, spread an anti-scientific, very militant in the sense of very violent, racist kind of, he and his associates, they spread those kind of messages in general. So this election is especially significant, I think, because of that. And I think we'll see more of that in the coming, weeks and months as well. We see how some of those campaign promises. Right now, Lula is comfortably leading over Bolsonaro. As far as the polls go, it's not clear if he's going to win an outright victory in the first round, which requires getting more than 50% of the vote. Right. But most polls show him to be in a substantial lead in the first round and very likely to win in the second round if he and Bolsonaro contest against each other as well. So that's where we are at right now. In recent times, Bolsonaro has really tried to sort of implement a lot more welfare policies. He's tried to keep the price of petrol low by getting Petrobras, the company, to sort of take some steps. But that itself shows the importance of welfare policies in some senses. Right. And Lula has a much better record with regard to that. So all said and done, a very, very important election.
Right, Prashant. Prashant, it's being called a crucial election. Why is it crucial for Brazil and for the region?
Right. So both very interconnected questions, because under Bolsonaro, what we have seen is the state largely being abandoned for the corporates in some senses, and a very extreme right-wing ideology, which is kind of unfortunately very toxic and vicious for not only for Brazil itself, for the entire country. Attacks on human rights defenders, for instance, attacks on people protesting. There's been a large-scale mobilization of people against these attacks in favor of democracy. We've seen multiple instances in recent times. So it's not surprising that many Brazilians see this election as an attempt to sort of reclaim democracy, or to reassert the democratic nature of the of Brazil, and which is why there is an extra edge to this election as opposed to maybe some in the past, for instance, because for many Brazilians this is a very vital moment if they want to keep their country on a democratic path, and that's what we see from many of the reports, from the slogans and the speeches that come together. It's a very vital election for a Brazil which is relatively more tolerant, more inclusive, more understanding. Brings in the minorities, the indigenous people, the sexual minorities, makes their space for women. So for all these sections, it's very, very important. Even the last election, we saw a lot of this. But after 4 years of Bolsonaro, many of these sections have sort of been more clear that this is a very vital election for those reasons. And at regional level, it's also a very, very important moment right now. We've seen that across Latin America, there's been almost a wave of victories by progressive and left-wing presidents and prime ministers we saw Honduras, we saw Chile, we saw Peru, Argentina taking place earlier, Bolivia reversing the coup. At this point, for instance, if Brazil also goes with Lula, as the polls predict, that will definitely mean a very, very vital moment. We also saw Colombia, for instance, Gustavo Petro winning a historic victory, and we're already seeing the results in terms of how Colombia and Venezuela are sort of normalizing ties again. It's a very important development for the entire region. But if Brazil also tilts in that direction, it probably marks maybe the culmination of this entire process, and it will mark the possibility of there being far more regional integration, far more regional coordination, which was really the promise of the first, of what happened in the earlier part of from 2005, 2007 onwards, when Hugo Chavez was in power, Lula was in power. There were similar governments across Latin America, all of whom were working together for much more regional integration, cooperation at every level, social, financial, political, etc. So there is a possibility that if this election turns out in Lula's favor, of course, this process might get further strengthened. Under Bolsonaro, we're definitely not going to see that. We're going to see far more right-wing policies, far more justifications for more of these divisive policies. So keeping all this in mind, definitely no wonder that people across the region and the world are looking very closely at what happens in Brazil this year.
Right, Prashant. Thanks a lot for that. And that is all we have for today. Thank you for watching Daily Debrief. We look forward to seeing you tomorrow. Keep watching us and follow us on Facebook, Instagram and Twitter for updates from around the world. And for more news and analysis, visit our website peoplesdispatch.org.